Thank you, everyone. Welcome to my seminar presentation. The title of my seminar is Inflammatory Bowel Disease of Dogs. Introduction. Inflammatory bowel disease is a collective term that describes a group of disorders that are characterized by persistent gastrointestinal signs and histological evidence of intestinal inflammation on biopsy material. It is somewhat poorly understood disease of dogs. Different types of inflammatory cells are involved during the development of the disease. Therefore, the objectives of this seminar are to highlight inflammatory bowel disease in dogs and to describe etiology, clinical signs, diagnosis and the management options of the disease in dogs. Etiology and risk factors. The cause of inflammatory bowel disease is idiopathic. That means the cause is exactly not known and it is somewhat complex. But different research shows that, or they point down different causes of inflammatory bowel disease, such as common antigens. These common antigens involve proteins and preservatives from food, parasites, viruses, and bacteria, and ingested foreign material. And the other causes are environment, genetic, intestinal infection, and abnormalities of the immune system in the dog. Types of inflammatory bowel disease. Inflammatory bowel disease are classified into 4 depending on the type of cells that are involved during the course of the disease. The first one is lymphocytic plasmacytic enteritis. This is the most common form of inflammatory bowel disease, and the predominant cells that are found in this one are lymphocytes and plasma cells. This produces small bowel type of diarrhea and vomiting. The second type of inflammatory bowel disease in dog is neutrophilic enterocolitis. This is less common form of inflammatory bowel disease, and the predominant cells that are found in this one are neutrophils. This type produces acute and chronic large bowel diarrhea. The third one is eosinophilic enterocolitis. This is relatively uncommon form of inflammatory bowel disease. Predominant cells that are found in these ones are eosinophils, and this may be caused by parasites or food allergy. The fourth and the last type of inflammatory bowel disease is granulomatous or regional enteritis, and it is rare form of inflammatory bowel disease. The predominant cells that are found in this one are macrophages, and this affects the terminal part of the small intestine and large intestine. Epidemiology of inflammatory bowel disease. When we consider the geographical distribution of inflammatory bowel disease, it is worldwide, but in Ethiopia until this time no research has been done on this disease. And when we consider the age of the pets of middle to later age are mostly affected. Any species of the dog are affected. When we consider the sex, both sexes, that means females and males are equally affected. The disease is not transmitted from dog to dog or from dog to another animals. Pathogenesis. This is the pathogenesis, how the disease is developed in the dog. First of all, there is entrance of foreign bodies or antigens into the bowel or into the gastrointestinal tract. Then this causes stimulation of gastrointestinal mucosa, and as a result of this, there is disturbance and deregulation of mucosal immunity, and this causes increased gastrointestinal tract permeability. When GIT permeability is increased, foreign antigens pass easily through the mucosa and affects the enterocytes. Then, as a result of this one, inflammatory cells are called into the area. Finally, inflammatory response or inflammation will take place. Then different clinical signs are observed after this one. Pathophysiology of inflammatory bowel disease. This is the involvement of hypersensitivity reaction to antigens. 2 types of hypersensitive reactions are involved in the inflammatory bowel disease in the dog. These are type 1 and type 2 hypersensitive reactions. Type 1 hypersensitive reaction is involved in eosinophilic enterocolitis, and type 4 hypersensitive reaction is involved in the granulomatous enteritis. And this hypersensitive reaction incites the involvement of inflammatory cells in inflammatory bowel disease. Clinical signs and symptoms. The clinical signs and symptoms of this disease are numerous and non-specific, and they vary depending on the part of the GIT that are affected. And for example, if there is stomach inflammation, the clinical signs that are observed are loss of appetite and chronic vomiting, sometimes with hematemesis. And there may be chronic diarrhea. This chronic diarrhea differs depending on the part of the intestine, whether large intestine or small intestine is affected. If small intestine is affected, the diarrhea will be large in volume, watery, and there may be melinna. If large intestine is affected, there may be hematochezia, mucus, and tenesmus. There may be the other clinical sign is weight loss and lethargy and inflammatory bowel disease of dogs. Let us pass to the diagnosis. There are different diagnostic methods that are used to diagnose inflammatory bowel disease. The first one is history of the patient. This is the first step during the diagnosis, and this involves the feeding status of the dog, the long standing diarrhea and vomiting, the duration of the clinical signs, or if there is any treatment that is given before or not given. The second one is physical examination. This involves by considering the body condition of that animal, but this is not enough because dogs may seem normal even if they are affected by inflammatory bowel disease. Also, the other physical examination is palpation of thickened intestines, but this needs very experienced veterinarians. Endoscopic examination. This is by using endoscope. This endoscope is inserted down the throat or through the mouth if stomach or small intestine is to be studied, and it is inserted rectally if large intestine is to be studied. After the endoscope is inserted, small pinches of tissue are obtained via tiny biting forceps. And the other is laboratory examination. This involves chemistry panel for enzyme, complete blood count for inflammatory cells, urine analysis to rule out any liver disease, and fecal examination to rule out any parasites in the GIT. The other is radiography and ultrasound. This is non-invasive method. The intestine may appear thickened during the radiological examination, and this rule out if there is any tumor in the gastrointestinal tract. The other is biopsy. This is the only definitive way to diagnose inflammatory bowel disease in the dogs, and this demonstrates if inflammatory cells are increased or not in the gastrointestinal tract, and this is obtained through the use of endoscope or exploratory surgery. And the last diagnostic method is broad spectrum deworming. This rules out the presence of parasitism as a cause of chronic inflammation. Differential diagnosis of inflammatory bowel disease. There are many different diseases that are confused with inflammatory disease. This involves parasites such as Giardia and Cryptosporidium, bacteria such as Salmonella and Campylobacter, liver disease, and hyperadrenocorticism. Treatment. There are two treatment options to control or to treat inflammatory bowel disease in the dog. This involves dietary management and medication. And under dietary management, we use hypoallergic diets such as hydrolyzable protein and carbohydrate source, diets of low and fast, complete and balanced home diets are used to treat inflammatory bowel disease in the dog. And the other is medication. Under medication, we use antimicrobial therapy and immunomodulatory drugs such as metronidazole, and anti-inflammatory or immunosuppressive drugs such as corticosteroids. These corticosteroids involve steroids, cortisol, prednisone, and prednisolone. Prognosis. The prognosis of this what is good if the dog is treated early. Then, but sometimes the prognosis is variable as many cases require prolonged treatment with glucocorticoid and diet modification. Control and prevention. The control and prevention of inflammatory bowel disease involves proper feeding of strict balanced diets, free anti-inflammatory medication to manage the disease, and following the status of the disease from time to time. Conclusion and recommendations. Inflammatory bowel disease frequently affects dogs. It causes inflammation of the wall of stomach, small intestine, and large intestine. Clinical signs of the disease depend on the location of the affected gastrointestinal part, and treatment involves dietary management and medication. Based on the above conclusions, the following recommendations are provided. Veterinarians should give due attention to the disease. The owners should report immediately after the clinical signs of the disease are observed on his dog or pets. Dogs should be properly managed and regularly followed up. And finally, further research about the disease should be conducted in Ethiopia, because since this time, until this time, further research are not observed in Ethiopia. And finally, I would like to say, save your dog from inflammatory bowel disease. Thank you.
Thank you, Gemechu, for your presentation. Now, I would like to invite Dr. Rada for questions.
Okay. Thank you, Gemechu. And I would like to tell you that you have really consciously done your paper, and it's free of any typographical error. I've really enjoyed it. Okay, saying that much, let me go to the questions. Okay, as you stated earlier, it's one of very rare diseases, that note. So what motivated you to work your seminar on such a rare disease?
Okay, this disease, I enjoyed the topic because in Ethiopia also, in our vet clinics, there are many dogs that came with this clinical sign, but until this time, no veterinarians suspect this disease is inflammatory bowel disease. But for example, many dogs are coming with the clinical sign of vomiting and diarrhea, and sometimes with blood diarrhea. And simply we give oxytetracycline and ivermectin by suspecting any bacterial disease or any parasitic disease. But it may be inflammatory bowel disease.
Is there an evidence of this disease in other animals?
Yes, mostly it affects dogs and the cats and humans that are monogastric animals.
So, what could be special with monogastric animals or human beings, and that favors the IBD to affect them? What do you think is special with human or any monogastric animal to contract this disease?
Because in monogastric animals, mostly in any other animals such as ruminants, mostly vomiting is not observed. But in human, their digestive system are created by nature to assist the vomiting and sometimes the diarrhea.
Okay. This disease is it mostly prevails in urban and developed nations.
Yes.
So, can you correlate this to the nature of the disease?
Still now, different research has been done in order to identify whether this disease is developed in mostly developing countries or developing countries. Well, ideally, we can consider that this disease may be in the developing countries because many dogs are now strayed and feeding on waste material, but they are not affected by this disease And different scientists suspect that this may be related to the living status of the developing countries. There is no concluded thing on this one.
So in relation to the feeding habit of dogs in developed nations, I would like to hear something from you. What type of feed does pets consume in developed nations?
For example, in developed nations, as I mentioned earlier, they feed on low, the diets that are low in fiber, because most of the time they cannot consume the fiber, or their digestive system cannot digest the fiber, and sometimes low in diet because the low fat diets, because they cannot, their digestive system cannot mostly digest fats, and hydrolyzable proteins and carbohydrates such as potato are given in the developing countries.
On top of that, they mostly
for example, they use homemade diets that are complete and balanced. Mostly they are prepared by the veterinary nutritionist.
Maybe I suspect there might be some allergen there. IBD has a lot to do with allergy, with hypersensitivity, so there may be some allergen there in canned feeds. That is my suspicion. And lastly, can you tell me any disease that is abbreviated as IBD, similar to this? Another disease that is abbreviated as IBD.
Infectious bovine.
Pardon me?
Infectious bovine disease.
What is another name for it? Another name for that? Bumboro? So, which species does it affect? All three of age. Which age?
Young.
Young ones, okay. I would like to congratulate you.
Okay, thank you, Dr. Adam. And I would like to invite Dr. Flash.
Okay, Gemechu, I would like to say also congratulations. Your paper is very well written, and it's very well organized paper. As Dr. Aga mentioned, I haven't seen any typographical error. And also coming to your presentation, I can say that it is the best presentation of the day. Please applaud. Good gesture in explaining your slides, and that's very interesting. And you have also good confidence in tackling questions. I have a few questions, just to cool down you. You mentioned this problem is most of the problem of developed countries and also urban areas. Is there any report in Ethiopia?
Until this time, no research has been in Ethiopia.
What do you think is the problem? Is it lack of competence of the veterinarians to detect the disease? Or do you think that the disease is absent because we are not a developed country?
But disease is present.
Are you sure?
This is maybe I suspect because I saw the clinical signs that I have already done on my paper.
Mm-hmm.
Then I suspect there is the disease in Ethiopia.
Okay.
Even if Ethiopia is not developed country.
So how often the case? How often you find the case in Ethiopia, or particularly in this now vet clinic?
Particularly in
Is it common? Are many dogs coming here had the problem, or?
Mostly in this semester, 2 or 3 days I have seen.
Okay.
But most commonly the disease comes with another case. but it's not very common. But I saw the clinical signs and symptoms that are observed on the dog that came in this clinic before 1 or 2 months in this semester.
Is the diagnosis quite difficult? If you have endoscopy equipment, is it difficult to detect the problem?
It needs very experienced veterinarians.
Okay. You also recommended further research on the problem. Is that practically feasible, or from the point of view of the presence of many infectious diseases in this country, is that economically feasible to conduct research on this disease?
Even if the diagnosis is very difficult, for example, the use of ultrasonography is very difficult, but by using the minor diagnosis such as physical examination, if there is endoscopic examination, and any other laboratory examination, we can study the disease in Ethiopia.
Yes, what I want to point out is that from economic point of view, for example, you recommend further research. If you, for example, prepare a research proposal and want to get funds from funding organizations, would you think that they will give you funds for this?
I don't suspect, because mostly our country depends on another livestock rather than.
What thing is that? The other thing?
And after treatment?
There are many infectious problems that needs priority. Yes?
Yes.
Than this, because how is the mortality rate of